shortness of breath, wheezing, tight chest. These drugs save lives in asthma, COPD, and allergic airway disease, and they're exam favorites. In the next few minutes, you'll master the mechanisms, uses, and key side effects of the top pulmonary drugs, essential for both the clinic and your boards. We classify pulmonary drugs into beta-2 agonists, short and long-acting, albuterol, salmeterol, anticholinergics, short and long-acting, ipratropium, tiotropium, inhaled corticosteroids, fluticasone, budesonide, leukotriene receptor antagonists, montelukast, methylxanthines, theophylline. Beta-2 agonists bind to beta-2 adrenergic receptors in bronchial smooth muscle that activate adenylate cyclase that increase CAMP that activate pKa that inhibit myosin light chain kinase that smooth muscle relaxation that bronchodilation.
Albuterol, short-acting beta-2 agonist. Mechanism of action is beta-2 receptor activation that bronchodilation within 5 minutes, duration 4 to 6 hours. Most common use, acute asthma attacks, exercise-induced bronchospasm, rescue inhaler. Exam side effects are tremor, tachycardia, hyperkalemia. SALMETEROL is a long-acting beta-2 agonist. Mechanism of action beta-2 receptor activation right-pointing arrow prolonged bronchodilation, approximately 12 hours. Most common use for asthma maintenance with ICS, COPD maintenance. Exam side effects are increased asthma-related death risk if used without ICS, tremor, tolerance.
Let's talk about anticholinergics. Mechanism of action. Anticholinergics block muscarinic M3 receptors in bronchial smooth muscle that inhibit IP3-mediated calcium release that prevent bronchoconstriction and decrease mucus secretion, and it include ipratropium and tiotropium. Let's discuss ipratropium, short-acting muscarinic antagonist aka SAMA. Mechanism is blocks M3 receptors that prevents bronchoconstriction. Onset 15 minutes, lasts 4 to 6 hours. Most common use for COPD exacerbations, asthma, adjunct to SABA. Exam side effects are dry mouth, blurred vision, urinary retention. Let's discuss tiotropium, a long-acting muscarinic antagonist aka LAMA. The mechanism is they blocks M3 receptors with slow dissociation that prolong bronchodilation, 24 hours. Most common use for COPD maintenance therapy. Exam side effects are similar to ipratropium, constipation, urinary retention.
Next up, inhaled corticosteroids. Mechanism of action is ICS inhibit phospholipase A2 that decrease inflammatory mediators, cytokines, prostaglandins, leukotrienes, that reduce airway inflammation and edema. Also upregulate beta-2 receptors. It includes fluticasone and budesonide.
Let's talk about fluticasone. Mechanism is potent glucocorticoid, reduces inflammation and hyperresponsiveness. Most common use for chronic asthma control, allergic rhinitis. Exam side effects are oral candidiasis, dysphonia, adrenal suppression, long-term.
Let's talk about budesonide. Mechanism is anti-inflammatory via glucocorticoid receptor activation, similar to fluticasone but slightly lower systemic absorption. Most common use for asthma maintenance, COPD, with LABA. Exam side effects are oral thrush, hoarseness, possible growth suppression in children, rare.
Next up, leukotriene receptor antagonists that include montelukast. Mechanism is blocks cystenyl leukotriene receptor CYSLT1 that reduces bronchoconstriction, mucus, and edema. Most common use for aspirin-induced asthma, allergic rhinitis, exercise-induced bronchospasm prevention. Exam side effects are rare neuropsychiatric effects, depression, suicidal thoughts, nightmares.
Next up, methylxanthines that include theophylline. Mechanism is inhibits phosphodiesterase that increase CAMP that leads to bronchodilation, also adenosine receptor antagonist. Most common use for asthma, COPD, second line, rarely used now due to toxicity risk. Exam side effects are narrow therapeutic index, seizures, tachyarrhythmias, 450 cypriot pounds metabolism, drug interactions.
Let's summarize in one table. Drug, mechanism, most common use, and key side effect. With a side-by-side table, albuterol, beta-2 agonist increase CAMP, acute asthma, tremor, tachycardia, salmeterol, beta-2 agonist increase CAMP, asthma, COPD maintenance, with ICS, death risk if used alone, ipratropium, M3 blocker, COPD, asthma adjunct, dry mouth, tiotropium, M3 blocker, slow dissociation, COPD maintenance, constipation, urinary retention, fluticasone, glucocorticoid, asthma control, oral candidiasis, budesonide, glucocorticoid, asthma, COPD, hoarseness, montelukast, CYSLT1 blocker, aspirin-induced asthma, nightmares, mood changes, theophylline, PDE inhibitor up pointing arrow CAMP, second-line asthma, seizures, arrhythmia.
Pulmonary drugs are life-saving and high-yield. Remember their mechanisms, main uses, and side effects. That's where the exams hit hardest. Review them often and you'll breathe easier on test day.